How do you do? Lane here. I edit Wikipedia. I'm going to be talking about how to edit science content in Wikipedia. As for myself, I edit health and medicine content, and I'm going to be using health and medicine as an example, but what I say applies to any sort of science. People who watch this presentation will be able to discuss with other people, have some idea for themselves of how Wikipedia is edited, what can be said about the scope of Wikipedia's coverage in the health sciences, and what practical things a person might do immediately to engage with Wikipedia's health content. There's different ways to consider how Wikipedia might be edited. The first perspective that I'm going to give is the process or the rules for editing Wikipedia. At the top of every Wikipedia article, I presume that everyone watching this is familiar with Wikipedia articles, there's a button that says edit. It's always been there. It's always been available for anyone to click. And the way the Wikipedia works, one of the gimmicks with Wikipedia, is that anyone can click this edit button at the top of the page. And if you click the edit button, a text box appears and the person can edit the content of the Wikipedia page, whether the text, the images, the citations, copy editing, phrasing, facts, data, whatever is in there. Everything can be edited by the person who clicks the edit button. That doesn't mean that it's a free-for-all. Wikipedia is not a democracy in which people vote on what the truth is. It's not an anarchy where everyone can do what it is that they think of doing without having to work with others. But there's a set of rules in Wikipedia. From some perspectives, the rules are very complicated. From some other perspectives, the rules are simple. If I were to articulate the simplest version of Wikipedia's rules, it would be that the content in Wikipedia is a summary of what is respected by authorities in any particular field. The rule of Wikipedia that I would like everyone to remember is that if information is added to Wikipedia, then the information that is added must be followed by a citation to a reliable source from which that information came. As examples, in the field of medicine, when people add health information to Wikipedia, the standard is to cite medical authorities, and medical authorities are the academic and medical literature. So, Cochrane Collaboration, Journal of the American Medical Association, perhaps Science, perhaps Nature, New England Journal of Medicine, Lancet, BMJ. What's respected in the field already is what people should be citing. After someone adds information and then cites a source in Wikipedia, this isn't so much something that the original editor needs to be concerned with, and it's a bit difficult for me to explain exactly how this works, but when someone edits anything in Wikipedia, that triggers alerts for reviewers to come and see what it is that they've done. Everything that happens in Wikipedia is reviewed by multiple humans according to different rule sets, and one of the primary rule sets is if someone's added information, did they also cite a source? After that amount is checked, perhaps the reviewer will escalate the review to someone with more authority or who knows something more about it. So in medicine, for example, someone might edit the content and see if it looks plausible. Is everything in order? Is a citation added after whatever sentence the person might have added? And if they're not an expert in science, then they'll flag a scientific reviewer to say, is this appropriate for this field of information? Or it doesn't necessarily have to be science. It applies to anything, pop culture, the arts, whatever happens, things are referred to higher authorities. So how Wikipedia works is through something called post-publication review. Instead of reviewing content before people submit it and before it's published, when people submit it before it's published, all the content is reviewed after publication, after submission, and revised as needed by the reviewers who come along sometime later. To review, and perhaps this would help anyone watching to understand the nature of Wikipedia, what is an encyclopedia? An encyclopedia is a summary of what reliable sources say on any given topic. Wikipedia is not a place to publish news, original research, ideas that have not been shared in publication in reliable sources elsewhere before. Wikipedia, it's it's not an original publishing platform, a vanity press, and a place to do advertising. So one identifies the most reliable sources, and it comes to Wikipedia with the intent to mirror what those sources say in Wikipedia. It's less useful to come to Wikipedia with an agenda and then try to find external reliable sources to match that agenda when the sources haven't been identified in advance. So anyone who comes to Wikipedia who intends to add information and cite the sources from which that information came, they're going to be off to a good start. The technical process of Wikipedia, I'm not going to go more deeply into that besides clicking the edit button, because people who are interested in editing Wikipedia, they figure out how to do that on their own. It's supposed to be intuitive, that if a person goes into Wikipedia, the technical process of editing, it's not so difficult. There's another way to explain how to edit Wikipedia, and I would say describe that. I'm going to describe that as the philosophy of editing Wikipedia. And if someone is already persuaded that it's useful to edit Wikipedia, then the other barriers that might come in their way, like where do I find good sources, how do I get through this technical process, they'll be easier, because a person who wants to learn something and wants to make something work for them will do what they need to do to make that happen. So why is it that anyone might come to Wikipedia and choose to edit? Where do people get the motivation to edit Wikipedia? Well, it's because of the traffic. Wikipedia is a highly consulted source of information in practically every field. When people publish, a point of publication is to be read, to share information. And so if it happens that there's somebody who has information that they want to share and they want to reach the largest possible audience, and they want that audience to be a relevant audience, they want the information to go to people who actually care about it and want to use it, then Wikipedia is a fine place to put that information. It at least should be considered. I'm citing a paper here. There's other papers that I could be citing, but this one's popular among Wikipedians. It's a study which shows, by means of internet traffic surveys, which websites are most popular in the field of health. Wikipedia gets a lot of traffic. NIH, number 2 perhaps, because of PubMed. WebMD, very popular advertising platform that also has medical information. Mayo Clinic, good partnership with Google, National Health Service in the UK, World Health Organization. CDC would be just past the World Health Organization, that's Centers for Disease Control in America, up to date, popular among medical students and doctors. It seems to be the case that in the field of medicine, and this is just Wikipedia's medical articles, this isn't Wikipedia in its entirety. So singling out the traffic, number of page views that are received by Wikipedia's medical articles, all the data available that anyone's been able to find suggests that Wikipedia is more popular than any other competing media outlet in the field of health. So the dark blue is information that's come from SimilarWeb, which is a survey company. The light blue above Wikipedia on the Wikipedia bar is what the Wikimedia Foundation itself reports based on the data gotten from the Wikimedia servers. So at worst, Wikipedia is best, and at best, maybe it's even more popular than what other sources say. There's an infrastructure in Wikipedia. There's a lot of content, just about every medical concept that is covered in other literature also exists in Wikipedia. And this is true for many fields. There's a heck of a lot of Wikipedia articles. This bookcase here demonstrates how much medical content Wikipedia has. If it were printed on paper and put into a bookcase and compared to a human, besides having a lot of content, it's available in a lot of languages. So actually all these books represent, a quarter of them represent what's in English language. Wikipedia covers 280 languages. About 80 of those are well developed and have translation teams that are taking good medical content from English and then translating it into the other languages. Some of that content comes back from the other languages into English as well. There's a body of academic literature which describes Wikipedia's medical content. Practically, so I've said something about what are the rules for editing Wikipedia. Add a citation after everything that you've added. How do you edit Wikipedia? Well, you get motivation. I said there's a philosophy. And if you're really motivated, you can figure out Wikipedia, start editing it for yourself. A practical guide, supposing you're ready to get started right now, what is it going to mean to edit Wikipedia? Well, if you're sold on the idea and you think if I edit Wikipedia, I'm going to be reaching a relevant audience that's seeking information that I have to share. But honestly, as with any new media platform, whether you're blogging, thinking about adopting a social media website, there's barriers to entry, and I'm just telling you based on the experience of working with hundreds of people that when people come to Wikipedia and they want to edit the first time, usually it takes them about 45 minutes to even make their first edit. They stare at the screen for about 45 minutes wondering what to do or where to get started. And most people don't feel comfortable with Wikipedia until they've spent about 40 hours on the website, which is a larger barrier than entry than, say, using Facebook, which most people come to understand within a few minutes. Twitter, maybe a bit longer. Blogging, people have some intuitive idea of how that works. But with Wikipedia, for different reasons, people take longer to become familiar with Wikipedia and feel comfortable adding content to the website, participating in the review process, receiving a review, responding to the feedback that they get. Different reasons. So practically, if somebody wanted to edit Wikipedia, I could say, meet a Wikipedian. That's if you have someone sitting next to you, if that's possible. Have them coach you through it. Or perhaps meet somebody online. Talk to a human in some way. This isn't very easy for most people. It's actually kind of difficult to meet other Wikipedians unless you're in a major city and have access to request these kind of things. And you'd be requesting it from a volunteer. There's not a lot of paid support anywhere for Wikipedia. So if you negotiate with a Wikipedian to coach you, it's going to be peer-to-peer, volunteer to volunteer, a friendly kind of collaboration. But if it happens somehow that you work at an organization, perhaps a library, at a research institution, maybe at a school, perhaps instead of committing hours of your own time to learn Wikipedia, you could pass it off to somebody else somehow, maybe a research assistant, a student in some way. And this is kind of a strange way to say, how do you engage with the website? Well, sometimes the easiest way to engage with the website is have someone engage with it for you. It depends on a matter of time. It's a certain amount of time commitment. It's not a continual time commitment. Like, for example, if someone says, I want to have a Twitter, I want to engage with Twitter and talk with people over Twitter. The typical way to do that is commit a few hours a week over a period of many weeks or months, and you plan to be engaged with the social media platform over months. With Wikipedia, it can be a more short-term engagement because after you've added the content that you want to share, it tends to persist in Wikipedia long-term. But still, there's that upfront time cost. Where does that come from? A good way, especially for researchers, is to give it to some kind of research assistant or student, if possible, who might have more interest in this thing and who might have more of a learning experience with using Wikipedia than a senior researcher would have. I happen to be employed by Consumer Reports, nonprofit organization that seeks to share health information in different fields. At Consumer Reports, I'm engaged in a health outreach campaign called Choosing Wisely. Choosing Wisely, like many health campaigns, there's a series of health facts that it seeks to distribute. As is common in a health campaign, there's some kind of messaging. And in the Choosing Wisely campaign, that messaging is backed with citations to sources and medical journals. It's quite conservative information that we're sharing. So Choosing Wisely gets this information from expert medical specialty societies that say, this is good information to share. Can you please share this in the health campaign? And then at Consumer Reports, I share this information in Wikipedia because I'm comfortable editing Wikipedia at Consumer Reports. So as an experienced Wikipedian, I put these facts into Wikipedia articles on different health topics. Say like different medical tests, sometimes drugs, medical conditions. So like EKG, ECG, electrocardiogram, or maybe a health article like diabetes, maybe a diabetes drug, metformin, different medical articles. And after that information is integrated into Wikipedia, then back to the health campaign, I report traffic metrics, which say, I put this information in this Wikipedia article. That Wikipedia article, after I put the information there, it got a certain number of page views. And so what I can tell you about this communication intervention is that I shared information in a place that an audience was going to seek information on this topic. And if the information from this health campaign is relevant to your audience, then they would certainly find it here in the Wikipedia section that was giving this information. So there's an aspect of delivering the information to an audience, and then there's also an aspect of doing proper communication and proving that a certain audience actually picked up that information and was using it at the time when they were seeking it. If anyone has any questions about how this works, you're welcome to email me. You can find me on Wikipedia, where I edit as Blue Raspberry, or email me as you like. Happy to talk with anyone who wants to talk about any kind of health or science content on Wikipedia. Thank you very much.